Stan, would you like to be paid?
No, thanks.
Public comment?
Good morning, my name is Steve Kaufeld, I live in the Township of Shields. I have a little piece I'd like to read to you. I read it to the HR, some of you heard it already, but I just want to make sure that it's presented to this additional committee. I had been appalled at the attempting of forced masking of humanity, which has now led to the attempted forcing of vaccinations on all the American population. Disregarding scientific reasoning or prudence has brought to the forefront the absolute worst in a certain group of people. I refer to them as authoritarians, desperately seeking more power over the citizenry of this country. They don't care that an EAU, so-called vaccine, with no long-term testing is to be administered without personal consent to every person ages 5 and up. There is now an experimental vaccination program being performed at UW-Madison on infants as young as 6 months old. The human race is not one large cohort of lab rats to be coerced into quantitative experiments. It brings to mind the repeating of history and how dictatorships came to fruition in the last century. Totalitarianism starts with a willing group of the populace that are micromanagers, control freaks, and narcissists. These people enlist the aberrant, fearful, easily led portion of the populace to deceive the majority of the populace that they are in the minority, not only in numbers but authority, and have no recourse but to obey and shut up. In science, there is the law: for every action there is an equal and opposite reaction. These COVID mandates, which are not law, has brought about the worst in a certain segment of the citizenry and has brought the best in others. Men and women who hold dear individual liberty, reason, logic, are coalescing and realizing that there are many within government which are resisting these unconstitutional mandates. Cities, towns, counties, states throughout America recognize this downward spiral into socialism and are calling the bluff of these sociopaths. The COVID cultists need to realize that there is no allowance for emergency powers in our Bill of Rights, nor mandates in our Constitution. Vaccine mandates have nothing to do with public health, but everything to do with public control, as we see evidenced in Australia. COVID cultists care more about the narrative than the facts. If facts were important, they need look no further than Singapore, Israel, Ireland, and more, who all have vaccinated rates in excess of 85%, yet their hospitalization rates are the highest in the world, with the majority being fully vaxxed. Unvaccinated people previously exposed have a natural immunity 27 times more protected than those who are fully vaxxed. This is a fact. This evidence is purposefully suppressed by an activist media and the cancel culture, which we all know exists. So the elephant in this room is, and this is an important question and statement, and think about this carefully, if, and it's a big if the vaccines work, then the unvaccinated pose no threat at all to the vaccinated. And if they don't work, then why are they mandating them in the first place? Would anyone care to succinctly answer that question? I think not.
I need to make a little correction here, Mr. Marsick. Do you want to be paid?
No, thank you.
No, I'm sorry, I missed you. I thought you did.
Hi, I'm Linda Kaufeld, and again, this is for people who haven't heard it, but I also spoke at the first one. I'm a retired healthcare worker, and I always dreaded fall because that meant the flu vaccine, and I always had to be concerned, where's it gonna go this year? And I'm one of those that actually left the job because of the flu vaccine, because I didn't trust vaccines back then. And now to think that these employees here at Clearview and these other agencies, dedicated, hard healthcare workers, I know I was one of them, and they're being posed with this dangerous vaccine mandate. Disgusting. So, I'm gonna read this. It was just a few short months ago that the public was attending these board meetings, and for the most part unanimous against masking. We had the foresight, knowing that if they control us with this mask, the vaccines will be next. And here we are, everything we tried to fight against, these dangerous vaccines. During the mask push, we were told, oh, it's just a mask, but we knew it was much more than just a mask. Months later, this what just the mask has now revealed, and I will reference only a few medical problems, ignoring the psychological damage masks are responsible for. Some quotes from Natural News. Mask mouth is spreading like wildfire, and dentists are warning that it could have serious consequences, including death. Gum disease or periodontal disease will eventually lead to strokes and an increased risk of heart attacks, warns Dr. Scavani. The bottom line is there is now an abundance of medical and psychological harm that is documented regarding the horrific dangers of just wearing a mask. Fast forward to today. Now we're being told it's just a vaccine, it's safe, and it's effective against COVID. I have yet to see any clinical documented scientific studies proving the case that the COVID experimental gene therapy jab is safe or effective. On the contrary, untold numbers of doctors, well-researched studies showing the hideous long-term health problems related to this jab. There's the VAERS report, and I handed it out to one of you folks here, which is normally, they say, is 1% of reported cases over, 18,000 deaths, and plus a multiple of other things that VAERS reports. You can look it up online, I don't have it with me now. So is it any wonder that we have masses of people refusing this jab mandate? Our healthcare workers, who were previously appreciated not long ago as heroes, who incidentally worked with infected patients, are now all of a sudden considered health risks and need to agree to a forced experimental vaccination with no liability to cover medical expenses if injured or die. And what about the patients left with inadequate care staff? My mother, cognitively aware, 95 years old, dependent in all areas from a stroke 2 years ago, resides at Marquardt Manor in Watertown. And I cannot give those people there anything but A+ marks for quality of service, other than cringing with this ridiculous mask mandate, which I violate as much as possible. What will happen to my mom's care when half or more of the staff are fired for refusing this mandate? If this was truly about health care, why is there no concern for the dependent patients left with this inadequate staffing? And realize there will be repercussions from this decision of vaccine mandates. Our own daughter, 15 years in skilled hospice. The jab mandated the vaccine. She was fired because she refused to take it. She found a new job. And you know what? She likes her new job. There's no mandates, and she gets $2 more an hour. So she's happy. So if you fire these people, they will reestablish lives elsewhere. They won't be back. At least probably a lot of them. And just in case you missed some of the headlines that are giving employees hesitancy in taking the jab, here's a few. Natural News Situation Update, November 15th, 2021. The vaccinated are dropping dead in plain view as Fauci admits total vax failure. Or this one. The CDC admits there's no record of an unvaccinated person spreading COVID after recovering. There's so much falsehood all going around, and our government is trying to, here's the dilemma. Ponder this, how the confusion in all of this and what they're trying to push on us. Our government is trying to convince the unvaccinated to get vaccinated because it's safe. And then it tells the vaccinated that their double dose vaccines are no longer effective and they will need a booster to be safe. And they can expect another booster, and another booster. The bottom line is there are so many lies and very real health crises and deaths related to this vaccine. But what is causing this? It's because we as a society are crumbling under government tyranny and media hysteria instead of standing together and fighting this. Thank you.
My name is Julie Shaw. I spoke earlier. Some people have already heard this. I want to add a few things to it. Besides the oath of office that people took to take care of the people and supposed to look out for the people, Clearview is less than 2 miles from my house. If this vaccination, the jab poison, is allowed, that means that people are going to be knocking on my front door to ask me if I'm jabbed. I ask all of you, are you jabbed? I can't answer that. You can't answer it. I'm not allowed to ask. If they come to my front door and ask me if I've been jabbed, that's a mistake. That's a total mistake. You guys allow this, this is going to open the door for everyone to come to your house and ask you if you're jabbed. Okay? That's not cool. That's just not right. That's not right. We are rural. I mean, half of us don't even have neighbors. If you want to get jabbed, get jabbed. That's your own private responsibility. You know, that's your own personal choice. I don't care. But I will not have it forced. You guys took an oath of office. I do have a copy if you need it. I can help you if you've forgotten it. Okay? It's ridiculous that a mandate is not a law. It's not even a law. Somebody back here mentioned to use our brain and come up with a different idea. As far as, getting together. Let's find out how we can take care of some of these people. Okay, you might lose a little bit of money. But somebody also said they're not going to pull the licensing right away. With the way the world's going, who knows if anybody's going to be here in 6 months. It's crazy. Everybody's gone absolutely insane. Can't we find a little bit of sanity with us here? This is Dodge County. I don't know how many of you guys got kids. I don't know how many kids we've got. Grandkids, great-grandkids. Have you seen a baby get a shot and die? Have you seen a person get a shot and go through death? I have. My uncle. A horrible, horrible, horrific death. And after all that pain, then he died. You want to do this to your people. You've already jabbed already, and you haven't seen anybody die? Well, I know people who died. I've done my research. Don't let this come here. Please don't let this come here. You want somebody coming to your front door and asking if you've been jabbed? It's just not right. If that's your choice, that's your choice. Don't force it on the rest of us, please. And like I said before, if you can't figure out how to work around it, if you can't stand up for our people after you took the oath, just step down so somebody else can get in your spot and take care of the people that are here. Thank you.
Anyone else? Okay, we'll go next item. Item 4, review discuss approach COVID mandatory vaccination policy and related forms.
Can you speak up, please? I can't
I'm
hear
sorry.
you. We can't hear you.
Oh, I'm sorry. We're going to item 4, review, discuss, and possibly approve COVID-19 mandatory vaccination policy and related forms.
Yeah, no, it's okay.
and residents.
See if that works.
I appreciate everybody's really afraid of this. Understand that when you cite stuff, I totally respect scientific articles. Those are peer-reviewed articles. I don't know if you're really citing a peer-reviewed scientific article. Our duty is first to the people who live here. Number one, and some of those people have died, and no one here has died of a vaccine. 766,000 Americans have died of COVID. Disagree if you want. Only a fraction, like from what I've seen, 3 to 5 people in the entire country have died of the vaccine. And if you want to find another study, just make sure it's a peer-reviewed scientific journal where they've actually done a study, because that's what scientific research is actually about. But our duty, even if we wanted, even if we, regardless of whether we want to or not, we haven't done mandatory vaccine, and we have waited, and now the federal government is requiring it. By the way, that requirement is called an administrative regulation. It's a law. It's an administrative law. There are entire courses on administrative law. It's a law that has to be followed. And everybody keeps coming up to the mic and saying it's unconstitutional. Again, the supremacy clause of the Constitution says that all states must follow the federal Constitution, the federal law. This is a federal agency. I know that Mr. Siegman says he's going to find something else. I'm happy to have him contact the Center for Medicaid Services and find out if they are going to give us an exception. Go ahead. But without an exception, Clearview will close. And we will not be able to care for the people here. And that's my primary duty. What's the next step?
I'm sorry.
What's the next step?
Well, we have all 5 committee members here.
Yep.
What I wanted to do was read through the policy. We started working on this, we discussed it with the committee last week, Monday. That was after the mandate had come down on Thursday. We had a chance to talk at the last meeting. We did some more work on it internally. I wanted to walk through this. We do have some questions that we need to address in terms of implementation and how we're gonna, move forward with, with this public vaccination policy. So, again, like I said, I'd like to just read through this, and you can ask questions as we go through this. So anyways, the purpose is to comply with the U.S. Department of
You're
Health.
gonna read this out loud.
Yeah.
Which one you're reading there, Ed? Is
The policy, the federal vaccine mandate policy. This one, it's ours. It says draft on top, 11/16/21. This is our policy. I'm not gonna go through the CMS mandate. This is our policy. Just so we can, so we can have some discussion on it.
Because we could just make like, that's here, just read it. Doesn't have to be out loud.
It doesn't matter to me. I just wanted to make sure everybody was hearing the same thing, including the
All right, that's
members of the
fine.
audience.
Sure.
So I don't want any confusion.
Sure, that makes sense. Go ahead.
All right. The purpose of the policy is to comply with the U.S. Department of Health and Human Services Centers for Medicare and Medicaid Services interim final rule, 42 CFR Parts 416M, 418M, 441M, 460, 482, 43, 44, 46, 491, 494, published in the Federal Register, Volume 86, Number 212, November 5th, 2021, year and after referred to as the CMS rule. And to protect the Clearview residents, staff, learners, visitors, service providers, and the community. Clearview is implementing a mandatory COVID-19 vaccination policy. Clearview is committed to the safety, welfare, and protection of our residents, staff, learners, and the community from COVID-19. We felt it was important to make sure that the specific regulatory references in the opening paragraph, again, we're not here to discuss the merits of the regulation. This is the regulations that we abide by. We literally have books of regulations we comply with. what we as an organization have to comply with. So our policy statement, all Dodge County employees and elected officials working at Clearview are required to be fully vaccinated against COVID-19 or obtaining a vaccination as a term and condition of employment or to work at Clearview unless an exemption or deferral has been approved. So all staff shall be required to report their vaccine status and to provide approved documentation as proof of receipt of the vaccine. All new staff shall be required to provide proof of their vaccine status prior to their start of employment. All records of vaccination and approved exemptions will be maintained by Dodge County Human Resources Department. So the applicability, the COVID-19 mandatory vaccination policy applies to all Dodge County employees and elected officials working at Clearview, Clearview volunteers, medical staff, and any contracted individuals receiving a Clearview badge and or access to the Clearview facility unless the individual qualifies for an exemption as provided herein. And this is where we wanted to have a little more discussion on the applicability in terms of how, the definition of Clearview, of county staff that enter the building, who this will apply to. Exemptions, an exemption may be provided to the staff with certain medical conditions and on the basis of a strong religious or sincerely held spiritual belief. A deferral, the receipt of the vaccine may be deferred for certain medical conditions approved and out on a block leave, date of positive COVID test or treatment for current pregnancy or breastfeeding. All staff denying an exemption or deferral shall have 10 days from the date of the notice of denial to receive the vaccine, either a single-dose vaccine or a first dose of the 2-dose vaccine. Contractors will be reviewed. An attachment will be added to ensure vendors, contractors, students, volunteers are abiding by the CMS rule. So, as we move forward with this, staff must receive at least one dose of the approved COVID-19 vaccination prior to providing care or any other services at Clearview by December 6th, and be fully vaccinated by January 4th, or will be placed on a unpaid general leave of absence for up to 30 days or until full vaccination, whichever comes first. If after 30 days has elapsed and proof of full vaccination is not provided, staff will be considered to have voluntarily terminated employment, quit or resign with Dodge County. COVID-19 vaccinations will be provided at Clearview or Dodge County Public Health at no cost, regardless of health insurance status. Staff will be provided vaccination information sheet and consent form, which shall be returned prior to vaccination. If receiving vaccination on site, individuals under the age of 18 must have a legal guardian complete the consent form. Staff will be paid time off for the time it takes to receive the vaccination and granted sick leave to recover from any side effects. Staff may choose to be vaccinated at a location other than Clearview at their own cost, if any, but must provide proof of such qualified vaccinations. New employees will be required to comply with the vaccination deadlines referred to above, or be fully vaccinated prior to providing any care, treatment, or services within a facility at Clearview. Before deadlines to be vaccinated have expired as set forth herein, staff will be required to provide either proof of qualified vaccination or be granted an exemption or deferral. Reasonable accommodations. Staff, exemptions, reasonable accommodations, and medical deferrals. Staff may qualify for exemptions from this policy due to medical reasons, medical condition for which the COVID-19 vaccine is contraindicated, or sincerely held religious belief, observance, or practice. Exemption request forms available on the Dodge County Human Resources website under Forms at Core Clearview Human Resources Department and must be submitted to the Dodge County Human Resources Director or Clerk. The Dodge County HR Director will begin an interactive accommodation process as soon as reasonably possible upon submission of a request form. A formal decision granting or denying the requested exemption will be made by the Dodge County Human Resource Director. Reasonable accommodations, requests for exemptions will be based on the standards of Title VII of the Civil Rights Act of 1964 for religious exemptions and Americans with Disability Act. Exemptions. Dodge County Human Resource Director may refuse any and all accommodations in accordance with the law. Requests for exemptions must be renewed annually as long as the policy is in practice. One of the changes we did here is we had discussed possibly having, if your request is denied, it would go to the next level, and we just, for conversation purposes, we made that Jim Milky. After some internal discussions, the ultimate, Sarah, it was basically our ultimate, she has the most knowledge in terms of HR and EEOC. So to have it go to another level within the county didn't make much sense because the level after that is the EEOC. So the process would be, if it's denied by Sarah, then you'd make a request to the EEOC and they would make the final decision. That's ultimately where these cases end up.
So just because people are so concerned about overreach of the government, I think we should just make a very simple change and say the Dodge County Human Resources Director may refuse any and all accommodations, and then let's add the word only in accordance with the law. So she only has discretion to do it within the law.
Where are you on?
On
But
the
the first
top
paragraph,
paragraph.
second from last line,
Got it,
last.
thank you.
Yeah. Accommodations only in accordance with the law.
Correct. Do you guys have a problem with that? I think that's what it means, what it, you know what I mean?
No,
It's
that's
saying-
When you word that, yeah, it's got it in accordance with the law already there, but what you,
I put the only before the in, only in accordance with the law.
only, okay, and remove it.
You're not removing
Just
it,
add
you just,
it.
Just
additional
adding.
word, just to clarify that
All right.
Sarah's only operating what she can do within the law.
No
Correct.
problem with me.
Can we back up just a touch, or do you want to go through?
No, go ahead. No, I'd rather have you talk about what's fresh in your mind.
Just back up by procedures.
Okay?
COVID vaccinations provided at Clearview at no cost to staff regardless of health insurance status. How is it being paid for? Are vaccines costing money to anybody here?
The vaccine itself is provided by the federal government, and we get it from the public health department. And then in terms of billing insurance, you are allowed, vaccinator is allowed to bill insurance for the administration of the vaccine. That's what, when you go to Walgreens, that's what they're being paid for, the administration of the vaccine. So, we actually don't charge for the administration of the vaccine, because we just have our staff giving it to the staff or to the residents. Any other questions or suggestions? Okay.
So it's, the vaccine itself isn't costing the county money, it would just be the time of staff to
The staff time,
give
correct.
it.
And Dina's our infection preventionist, so she's engaged in those activities as part of her job. Staff may request a medical deferral for certain medical conditions approved and out on a block leave, need a positive COVID test or treatment, or current pregnancy or breastfeeding. You just had a recent positive COVID test. What's the timeline before you can have a vaccine after you've had a positive COVID? 2 weeks. There's, which would put you outside the time, it could potentially put you outside the timelines. So, and even, for a medical exemption, the form, it's between you and your physician. And if the physician says it's contraindicated for whatever reason, we don't get involved, correct, Kim? There's,
Right, and the form, when we get to the forms, you'll see three forms. One is for the religious exemption, one is for the medical, and one is for the medical deferral.
Okay,
So the physician will cover the medical exemption as well as the medical deferral.
okay.
We want this physician or a licensed practitioner, I think is what the law says. Licensed practitioner has to complete those forms.
Okay.
it is not up, that is not up to our discretion. That is between you, or royal you and your physician. It's the same thing with the deferrals. If the physician says you're not able to receive it at this point in time, they would let us know when. They're required to provide ending, correct?
It is, it does.
So deferral request forms are available from Dodge County HR website under Forms or Clearview HR Department and must be submitted to the Dodge County Human Resource Director by email. The Dodge County HR Director will begin an interactive accommodations process as soon as reasonably possible upon submission of a request form. Final decision granting or denying the requested deferral will be made by Dodge County Human Resources Director. Decision to grant or deny the deferral will be made based on information provided by a licensed medical practitioner, setting forth the reasons for the deferral and possible accommodations during the deferral period. Staff who do not qualify or have been denied an exemption or deferral shall have 10 days from the date of the notice of the denial to receive the vaccine, either single-dose vaccine or first dose of the 2-dose vaccine. If after 10 days has elapsed, the proof of full vaccination is not provided, staff will be considered to have voluntarily terminated employment enforcement, violations of this policy or associated procedures may result in appropriate disciplinary measures in accordance with Dodge County personnel policies and procedures, Clearview general rules of conduct for all Clearview staff and other applicable Clearview policies, or as outlined in any procedures document related to this policy. Any questions about the policy itself? Let's go to the two more straightforward ones are the Clearview COVID-19 mandatory vaccination declination. This would be the medical exemption. So as you're looking through the form again, we started the form with the regulatory reference. So if a person is unable to receive this vaccination due to a medical condition for which the COVID-19 vaccination is contraindicated, in order to qualify for a medical disability accommodation, a statement from a licensed healthcare provider, whom the physician, nurse practitioner, or other licensed medical professional practicing under the license of a physician must be completed. And that's per regulation, correct?
Is correct.
This form should be completed and provided to Dodge County Human Resources Department. Note, do not state the nature of the underlying medical condition or disability. However, natural immunity is not a qualifying medical condition. And that's just straight out of the regulation that does not qualify. So, you know, there's the name, their date of birth, the name of the physician providing the deferral for the exemption, anticipated duration of the disability, if indicated as temporary or permanent, and then identify possible accommodations. By completing and signing this form, I certify my client patient listed above should not receive the COVID-19 vaccine due to explain the specific contraindication of vaccination here, but do not identify underlying medical condition or disability. Attach a separate sheet or statement if necessary. So we, you know, when they provide this, we have no idea what the underlying condition is. They don't tell us, we don't ask.
We don't need to know?
Don't need to know.
If someone comes in with this medical deferral, is if they have a signature and they have a licensed medical doctor or nurse practitioner or whatever, saying that they're agreeing that, or they're saying that it's not, this person should not get the vaccine because of whatever reason, as we heard in public comment, what happens then?
If the physician states that they cannot receive the vaccine, and again, we don't know why, but the physician says, that's between them and their physician, then we accommodate them, and Dina and Aaron can probably speak to what the accommodations would be, but generally speaking, would be wearing a N95 mask and goggles the entirety of your shift.
So they're not talking about, to be honest, necessarily what these folks were talking about. So contraindicated means if you have something, right, like leukemia, and getting the vaccine is going to push your immune system right into end-stage leukemia, right? That's contraindicated. So, you know, they're saying if something's, we've got some serious medical issue, so the physician's not gonna sign this because you have a cold.
Well, you know, we heard in comment that there's a lot of doctors out there that says you don't have to have the vaccine, or you shouldn't get the vaccine. If that's somebody's physician that says, I won't sign this,
Yep.
and then they are getting a deferral, is that what we're?
Well, this would be the exemption. Deferral would be for more of a temporary condition, like,
So they'd have the exemption, then.
if it's a
bring
permanent
in a
condition.
from a doctor.
However, in our policy, we're requiring it to be to be updated annually, because, you know, there's permanent and there's permanent.
Right.
So,
But then they'd fall under other procedures, and maybe it didn't come to that yet, where they would give an accommodations.
that's where that falls under the accommodation, and, you know, in conjunction with HR and our infection preventionist, we could determine what would be necessary to minimize the potential for them to spread COVID
Okay.
or transmit.
Okay.
And we just accept an exemption and signature as valid.
Well, you have to determine it's a medical It has to be somebody,
Their license number.
a licensed doctor
So we
practicing
can
as a
check
doctor.
the.
We can verify that they are physicians.
Yes.
Yeah, that's it. Yeah,
Then it's out of our hands really because it's a licensed medical.
It's between the individual and their physician, correct? For the medical provider, yes.
I made that clear. What's next? Where are we?
All right, so, again, like the form is certified, and then next we'll go to deferral, which is very similar opening. Anticipated duration of the disability requiring the deferral, and then they just, by completing this form, and again, they correct him, they don't disclose that either, why they need a temporary deferral.
No, they don't.
We have those four things outlined in the policy, however, there could be others that we don't know about.
Question, are the accommodations set by CMS to?
No, CMS defers to the facility to come up with the accommodations to limit the spread. However, when the surveyors, the state comes in and surveys you, and if they don't believe your accommodations go far enough, then you can be cited for that.
Because they've come in and told us how we operate right now.
Yes, and that, but again, that's why we have an infection preventionist on staff. You know, that's her area of expertise. She's able to determine
Okay.
what level of
I don't
Accommodations.
question, I just wanted to know if, because they do it now, basically tell you what you have to wear, what you have to have, when you have,
and it,
and if someone, when you have a patient, or, you know, you're quarantining and all that stuff.
yes, and if the patient is active, if we have active patients, then we have the transmission-based precautions, and that's a different level of PPE that would be required.
So the accommodations would probably follow state and other guidelines and
Yes, and
other things that.
Standards and practices.
Keep in mind that accommodations, with an accommodation, when you have a request for exemption, particularly under the ADA, you need to have an interactive process with the employee. So accommodations really aren't one-sided to be imposed by the employer. There needs to be an interactive process with the employee about how to best accommodate, and a determination whether or not an accommodation is an undue hardship on the employer. Now, certainly the guidelines with patient safety and care would come into play. That would be some of the things that Sarah would be working with Clearview staff about. But the accommodation process needs to be interactive. It's not a cut and dry, here is your accommodation.
Yes,
It needs to be
for
a
a
process.
frontline caregiver, our accommodation can't be that they telecommute, it's just
Right.
not physically possible. When you start getting towards, if you look at, say, the business office, maybe not, but again, it just depends on what the nature of their position is.
They gotta be
If employee trust, if they need a
Right.
resident trust fund, then they have to interact with the residents, so you can't accommodate being telecommuted, so. Again, that's what she's saying, it's an interactive process, because not all positions we have are the same. And that 30% isn't necessary, when we say it's 30% unvaccinated, it's not as though it's 30% of the caregiving staff, it's 30% of the staff, and we don't just have all caregiving staff either. So. All right, so now we're gonna get onto the religious exemption. Okay, we haven't assigned a policy number here, that's why it's policy number 20. So, but in accordance with policy number, Clearview COVID-19 vaccination policy, Clearview requires COVID-19 vaccinations for all Dodge County employees and elected officials working at Clearview. The openings are essentially the same. So how do I apply for religious exemption? So what's required is you have to complete the attached COVID-19 vaccination religious exemption request form. The exemption request must present clear connection between a sincerely held religious belief, observance, or practice. Optional, you can provide supporting documentation, attach documentation from your religious leader that explains why your sincerely held religious belief, observance, or practice justifies exemption from vaccination. Examples of requests that may result in denials: misinformation such as microchips, magnets, DNA altering technology, adverse impact on fertility; legal arguments, requests including regulatory or privacy justification for vaccine exemption; fetal stem cell, tissue, or derivative materials. These ingredients are associated only with Johnson & Johnson vaccine. Pfizer and Moderna vaccines are available. Animal cells, tissues, or derivative materials, animal products are not used in the manufacturing of COVID-19 vaccines. Social, philosophical, political, or economic beliefs. Secular or religious statements, for example, quoting or citing scripture or sacred texts, without a clear connection between a sincerely held religious belief or principles and vaccination. Religious texts are open to interpretation, and religious exemption requests must provide that interpretation. So, it does put the onus on the employee to show the connection between their sincerely held religious belief and the vaccine. And there's several tests that go along with that, Kim, Sarah?
There are.
You know more about that.
There are, and with religious exemption, also there could be further inquiry by the employer as well. So, there's kind of a flow chart in terms of analyzing whether or not a sincerely held religious belief exists. And then if the HR director gets to the point where yes, one exists, then same thing, you have the interactive accommodation process.
Okay.
And if it's denied, then it would go, you would appeal it to the EEOC. They're the ultimate decision maker. So,
Well, that's the first step, and then if they deny you want to appeal again, you can go to the trial court. So,
Well, yeah,
they're
you're
not the
right.
ultimate, they can
You're
just
right, you're right.
keep suing and suing.
I'm not an attorney, you're right.
If it's federal or state, you can go to the Equal Rights Division of
Yes.
the DWD as well.
Yes.
So that's why it says federal or state
Mhm.
agency.
How is the misinformation section going to be, like, decided on? If somebody says, I don't want it because of this, and we believe, like, you guys believe it's misinformation, how are we gonna prove that?
I think they're listing out, this didn't necessarily came from us, like, we
No,
saw
this one we,
This actually came from
Okay.
the federal government, because,
no, this came from,
I mean, I read something that had this exact thing, like, we didn't make this one up.
no, we did not.
We did
Some
not.
employers are using this.
Yes.
Yeah.
And so what I think the intent is listing those examples. If somebody completed the form and said, I'm not gonna get it, I don't want the vaccine, it's against my religious belief because there's a microchip in it. So that's probably gonna be denied. I think the intent there is just to give examples
Just
of
let, yeah.
what you shouldn't
There's no
put on the form.
microchips in there. There's no
If you
magnets
say
in
a
there.
microchip, and, I don't know, I have proof that there is one in there, and here's my
That's what I
proof.
mean, like, the last one was adverse impacts on fertility, and I know people have brought that up before
Mhm.
in other meetings. How are we going to prove that that is misinformation?
Well,
Versus
I
if you
think-
say they bring up something that shows, oh, it, however.
It depends on what the thing is,
Yeah.
right? So I did my own research, it's not gonna cut it, I can tell you that right now. But I think, I haven't specifically reached this, but, I know a lot of people way early on were nervous about the, whole pregnancy, and then a lot of babies were born and died. So that was kind of sad, but we're still allowing that pregnancy exemption. But in terms of misinformation, they've got, again, peer-reviewed journals, right? So that means they go through a rigorous process. It's very, very detailed. It gets submitted, and it's peer-reviewed by experts in the field, right? And so that kind of stuff, she could probably do way more than I know on this, but they've already done that kind of research, right? That's why they're saying, no, adverse impact is not, because research has shown there is no adverse impact on fertility, especially when we've already had 300 million plus people vaccinated.
So if somebody were to come, I'm just using that one as an example,
Yeah.
of something that is deemed as misinformation, but they come with they find some peer-reviewed study somehow.
Mm-hmm.
Because we know there are studies that conflict, they're always in everything there are. So if they come with a study that shows their reasoning,
Mm-hmm.
but we have the study that shows it the other way, how are we gonna go with that?
I think Sarah's going to have to look at, like, are there 99 peer-reviewed journals that have done this and found it, or is it
I'm not
one?
quite sure how that,
I think
That's
I would be
serious.
working with Sarah to advise her on what we need to further inquire into to determine where we come down on whether or not to grant the exemption. So it'd be case by case, but I just want to bring up, you know, your question about fragility, and you were, I think, using it just as an example, but, and every exemption request certainly is going to be individualized, but if somebody has that concern, maybe that's a concern they bring to their doctor, so they do a different exemption, and they do a medical exemption. And certainly we're gonna accommodate, because we need to follow the pregnancy rights and the laws with regard to pregnancy. And that really does fall under the ADA and a different law, so maybe they choose to do a different exemption, not sincerely have a religious plea.
I don't know that they have to actually fill this out if they're pregnant, do they? Do they still have to fill it out if they're pregnant? Okay. The
Medical.
pregnancy.
Medical.
Okay, they fill out the medical if they're pregnant, okay.
And that's something, you know, when the state comes in and they survey us, they're gonna say, okay, who's vaccinated, who's not? If they're not vaccinated, why aren't they vaccinated? You don't have to have all these forms to show them that, you know, Ed was pregnant at the time, so he had a medical. Well, but I'm just saying.
Right, yeah.
One question I had on, I know that Fifth Circuit had talked about injunction mandate. Is that in any way affecting any of this
So the Fifth
in what we
Circuit,
do?
the Fifth Circuit action is regarding the OSHA
Yeah.
emergency temporary rule, so it's not impacting the CMS rule, but there is pending litigation with regard to the CMS rule.
But there was no injunction on that.
And there was no injunction out of the Fifth Circuit.
Right,
Right.
so the OSHA one has nothing on, it's not like we're doing this because we got over 100 employees, it's because of CCMS or.
Correct, and the federal government has said that CMS prevails over the OSHA
Okay.
when CMS applies.
Good.
So the CMS rule applies. But I will just let the committee know and everyone here in the audience, we're monitoring what's going on with regard to the CMS rule. And if something happens out of that, it's in the, I believe it's the Eastern District of Missouri. So it's not the Seventh Circuit.
We're the seventh.
Governs Wisconsin.
Yeah.
But it still is a pending action with regard to the CMS rule.
Yeah.
And it bears monitoring, and that is something that we will monitor to see if anything comes out of that circuit. Because like the Fifth Circuit, the injunction request was to enjoin the Secretary of Labor. And that injunction would have applied nationwide. So we're kind of doing the same monitoring with the CMS rule.
So what would the liability of the county be, say we pass this, and it ends up going to court, and this completely gets overturned, but that we passed it? Can somebody come after the county and say you did something that's unconstitutional and we don't like that?
No.
Okay.
No, because it was constitutional at the time. This CMS rule has not been declared unconstitutional.
But just say it at some point would be,
We're not violating
Not
the law.
but let's say it's invalidated.
Whatever.
It was an overreach.
There's not a retroactive application.
Okay.
And it can always be, there could be an injunction or a stay until it's settled.
Do you know if
Then we
there's-
could, I don't want to use the word, what's the legal term, but shelve it until,
Is there anything filed in the Seventh Circuit, you know?
I've never heard anything in the
Okay.
Seventh Circuit on the
All right.
CMS rule.
So, I mean, until something is, affecting us or filed, like, we're not subject to the law of that circuit.
we're not subject to.
It's like trial courts, it's like the trial court of Missouri and the trial court of Wisconsin, and then on the federal courts, it's all these different circuits, and that's when the Supreme Court takes them. When one place says you can get an abortion, the other says you can't, that's when it goes up to the Supreme Court to decide when the circuits are conflicting. The Fifth Circuit does not control the Seventh Circuit, and vice versa.
Is there any kind of a time frame on when we're gonna make these decisions by?
I wish I knew, Larry. But, no.
And unfortunately, we have to operate under the assumption that this is the law of the land, and these are our deadlines, so.
We would be in trouble if we actually said we can't do it because it's in the Fifth Circuit, then we'd get in trouble.
So this could go on for months or years or?
You know, 4 years from now, they could say, well, we finally made a decision, you shouldn't have done it. Well, but in the meantime, this was the law or this is the rules we had, and this is what we have to operate under, and, you know,
Yes.
and in that time, they can take away our licensure and our funding.
Yes.
So it's,
So if in, say, a year, yeah, they say, no, we probably shouldn't have done that, nobody can come back.
no, they can't come back at us. We would just change our change our staff vaccination policy.
There's a word for that, like post facto, ex post facto. Yeah, so you can't go back and say, oh, now it's a crime. That's actually unconstitutional. That's in the Constitution.
It'd be like going back on if abortion is
Yeah.
overturned.
That one's right there. Lack of money.
All right, so some of the points we wanted to discuss regarding these is they specifically do not require assisted living and group home employees to get the vaccine. And I wanted to revisit that because do we want to make this rule apply if it doesn't specifically apply to a certain group of employees working in it? Now, we allow them to cross over between the buildings now. However, if we say you go from an HA2 to an HA1, which doesn't require the CNA licensure, then they could work exclusively in the assisted living or the group home and not work in the nursing home and not be subject to the mandate.
It specifically says that even contractors who occasionally come into contact with people who come in contact with the residents, right? So,
In the nursing home.
yeah, but like, I think it's a myth to pretend that, like, we're gonna completely isolate people who are in assisted living on the Clearview campus from getting exposed to people who are on the Clearview campus. And also, I said this before, we specifically hired those particular people with CNA experience so they can provide service. So if somebody fell out of their wheelchair, right, or whatever, or they're so short, they're so short on a staff, right, that they can switch back and forth between them. I mean, we're really, really short-staffed. Why would we?
I understand that.
So I think, I disagree, not that I'm
I
not a
understand,
federal,
but
but I
it is-
disagree. I think the rule applies already. It applies already, because if anybody is in contract with anybody, right, who is a resident, unless we severely restrict our ability to use our staff, we lost 14 people last month, we lost over 10 the month before, we're fairly significantly, like all other nursing homes, short-staffed. And then what happens to the care that's provided to these other people?
So I do think this is a committee decision, and we should have the discussion and debate about it, because the rule does not apply to assisted living, Soul Trail, and Northview. But in the context of what you're describing, you know, should it apply campus-wide? You can have it apply campus-wide, or you could be in the camp of, and I'm not saying there's a right answer here. I think this is what the operations will bear out, and what the committee decides what it wants to do, based on shortage of staff.
Yeah, I mean, I'll be
Do you want to
interested.
apply campus-wide, or do you want to narrowly apply the policy as it's written?
So remember too, that normally, if somebody owns a license, they have an assisted living facility, and that's their facility, and there's nothing else next to it, and everybody there works in it. It's treated as a completely separate thing. Ours aren't. Ours are on the same campus, the people intermingle, and I'd like to know how we're supposed to try to get people to just get baths on time, to get their dinner on time. Like, I know that some superiors have had to jump in just to give dinners. What are we gonna do, right, if we're not gonna allow that back and forth for staff? We've just lost, and you guys know, at the last meeting, how many staff we've lost.
But, again,
So will we-
I want to play the devil's advocate. There's also the, you know, just because of the staff that works in those facilities now, some of them tend to be more on the, inclined to leave over the mandate. It's, you know, some of the thought we've had on that, and, you know, it could work against us that way as well.
So that's what I was thinking or worried about there. So somebody's in an assisted living, they're working in assisted living, and we mandate it campus-wide, are they just going to up and leave to a different assisted living that's not mandating it, and we're gonna lose them completely
tail should wag the dog, right? Like, it shouldn't. Like, they should do a policy that's based on what's gonna protect our residents. Like, we
But
talked
we
for
don't
2
have
hours about
staff.
the employees, what's gonna protect the residents?
If we don't have staff, we can't protect the residents.
We don't know that. You don't know that. Like, we don't know. No one, and even if they say, we do not know what's gonna happen. And so to make a policy as a governmental entity based on information we absolutely do not know, no one here can give me 100% on what's gonna happen. No one. I don't even care if everybody even filled out a form, because they can change their mind. And if they want to go to, remember too that if they want to go to any other facility, any other nursing home, anywhere, they all require masks. They want to go to the hospital, they require masks. They require vaccinations. Everybody around is required. We're like the last hole here. So I don't know where they're going to go. And you just told us only 2% of people left.
That's
Nationwide.
That's nationwide.
Yeah.
And that's, you know,
That's
you know, not-
nationwide.
That's
Right.
not facility by facility, that's nationwide,
Yes.
isn't it? And I think Haley's point was that they can, if they leave Trailview Community Group Home, Northview, they can go to another, you know, standalone assisted living, because there's not a mandate there. And I'm just trying to play devil's advocate here. I want to make sure we're considering all, you know, all outcomes, you know, we want to make sure we're considering
And
everything.
I can tell you that
because-
assisted living facilities in this county, just based on my practice with emergency protective placements, guardianships and protective placements, are also, as you know, permitted for staff. So that is an option if somebody does not want to be vaccinated, and a particular assisted living facility doesn't mandate by their own volition vaccination policy. That's an option. Or they could go down the street and completely get out of being a CNA and do a different job. I mean, that's certainly possible.
Or they could they leave, go down the street and come back in 2 months and get a signing bonus?
No,
Okay, I didn't know how
they
that-
cannot get that.
Not here.
Sorry,
When you're looking at,
not Santa.
again, the option though is if they would have to drop to an HA1, which could, you know, I think all of them would result in a drop in salary, become an HA1. So I mean, there's a financial risk to them if they opt to go that route. If they want to stay with Dodge County, you know, and we want to narrowly define who's included, we could keep them there, but they would have a reduction in pay because they're no longer CNAs for us. So they'd have a reduction in pay. We could accommodate them. I mean, any sort of HR things they need, they can come to this building for, as opposed to going to the Clearview building. So I just want to throw this out here. I want the committee to decide, because, you know, if an employee choosing to go that route, they would take a reduction in pay most likely. They would not be able to be a CNA anymore for us, but we can't accommodate them. But there is the risk for us that we can't pull them to the nursing home anymore.
Also,
However-
they go to a different assisted facility, they're not gonna get the same pay. They're taking a pay cut. That's a fact, because they're not working as CNAs at an assisted living facility. So they're not just taking a pay cut here. They're not gonna leave and get the same pay.
I don't know what the salaries are at the other facilities.
Do you know what other similarly situated facilities, like Marquardt, who was brought up today, Marquardt has a number of different levels of care. Do you know what they're doing?
From what I've heard, it's kind of across the board.
Okay.
It depends on, it really kind of depends, it's a philosophical question more than anything.
I mean, I don't wanna put anybody on the spot, but like, I mean, I was on this board and Larry, when we came up with the idea, right, to have this dual certification so that people could go back and forth. You know, we got director of nursing. You think there's gonna be no impact on care if all of a sudden we can't do that shifting back and forth?
No, I mean, the shifting back and forth is something we've always done, you know, when we're able to. I mean, right now, it's tougher than other times. I mean, at the homes, we have different rules and regulations, so we can do different things at the homes. We can mandate and stuff like that, but we try not to by supplementing with our staff to go over there. And the same thing, like if they're overstaffed,
Mm-hmm.
we can bring somebody back to the
me.
Aren't my nurses from the main campus?
Yes?
Do go over and assess, the residents at the homes.
Oh, well, then that
Well.
answers it, because the rules say if they're exposed to somebody who goes into the building, they're just like a contractor. I mean, unless we're gonna get some nurse to assess them who doesn't work on the Clearview nursing home.
Well, if the nurses who stay at Clearview are gonna be vaccinated, so if they go to the homes.
They're the nursing home nurses
Right,
that go there to do the assessment, so they're vaccinated.
yeah.
That's
From
not
my
how I
understanding,
read
the
this.
staff could go from the nursing home to the assisted living.
That's
It's just
not,
they couldn't come.
no, because they're exposed, you can transmit through vaccination. Dan made that point, and it's true, so, no, it's not, if you're unvaccinated, you can have that contact. I frankly, I think you can maybe approve this as is, and maybe amend it later, but I think we need to do, like, I mean, I don't have that language in front of me. Maybe Kim could take a good look at it, because based on what she just said, we're gonna be in trouble if we have nurses that work in the Clearview campus and the nursing home and go out to assess, then they're in contact with staff, and then they have to be vaccinated.
And they will be, because.
No, the staff at the, yeah, who's exposed to them, that's
I'll look
what I
at it.
read.
I don't read it that way, but I will definitely look at that.
Well, it did say, that's why it applies to a contractor, somebody who just comes in once in a blue moon, who is exposed to, like, say, the nursing staff here, that contractor must be vaccinated, even if they come in once every 6 weeks. So, why would that not apply? It's the same concept. So if they're in contact with someone who's in contact with the nursing home provider, they need to be vaccinated. That's why I was saying, it's an artificial distinction. It's artificial because they're not separate on our campus. They're not separate, and we have people going back and forth. So I'm just saying,
I'll definitely look at the rule, but.
I think you should.
What I'm struggling with is, we're talking about a nurse that works at Clearview full-time,
Mhm.
going to an assisted living facility, whether it be on our campus or anywhere else,
Mhm.
to assess the person.
Mhm.
That nurse goes home at night and she goes to the grocery store.
That's not what the rule says.
I
I'm like just saying, that's not what the rule says. It's
So-
very clear what the rule, the language is
Yeah.
pretty clear, Kim.
So I'll look at the rule, but we have to have some.
I guess what we're looking for is from the committee, maybe you wanna do a show of hands as to whether or not you wanna narrowly define it, or do we wanna be more narrowly defined and limit it to the nursing home, and we would make the exception for the assisted living?
This is not a committee decision. This is a legal decision. And when I'm not coming up with policy, I'm coming up with what I read in the rule, right? And so we cannot violate it. So I'm happy if you find it.
Yep.
I'm happy to look at it, I'd like you to look at it, it's, but I do not believe, based on the wording, that this is our decision. I
So,
don't.
how about if we do it this way, or you do it this way? You make a decision how you want it, subject to a final legal review of the rule. Because my review of the rule would say that you don't have to impose this policy on the assisted living facilities, and there's a list included in the rule of what you don't have to impose.
Yeah, I'm not
policy.
talking about that rule. I'm
I
talking,
understand what you're saying, it's the connection, it's the contact.
That's
Anyone
in
that
there.
comes in contact with somebody who's providing patient care.
Correct.
Which is exactly what the rule says.
Yes.
What I'm saying to you is, the committee needs to make a decision, I will certainly do a legal review, and I will give my legal feedback, and we can amend the policy if I'm wrong about it. I don't think I'm wrong,
Do you have
but
a
I will
question?
review it again.
you look like you're gonna talk. No. Were you gonna say something? Because you went.
No, it's just my thinking face.
All right, thank you. I would like to look at the language. I don't think this is a committee choice. We can't just decide we're not gonna follow the rule. We can't decide we're just not gonna follow the rule. It gets us in just the same amount of trouble. If I'm right, Ed, and we have a survey and we've done everything right, and they go to the nursing home, or they go to the assisted facility, and they found out they're not, and then they find out how we're going back and forth, right? We get in trouble. We would. I don't even know why this was presented as an option.
You can segregate the assisted living. I do believe you can do that.
What nurses are gonna assess them then?
Your point,
What nurses would be assessing them that wouldn't be in this facility?
a vaccinated nurse.
They did not distinguish between that because frankly, it passes through both. Actually, did you sit on it at that hour-long thing? I did too, and I specifically, I mean, I didn't record it, but it is recorded.
It is recorded.
But he made it very clear, if you're in contact with somebody who's in contact, right, that's the ultimate rule. The exception for assisted facilities is because we're assuming they're completely separate. They're 3 miles away, they're separately owned, they're independently operated. That's not what we're doing. We have people going back and forth more than we even have contractors. Some contractors coming in here who are gonna have to be vaccinated. There really isn't a difference. I mean, you don't like it, but that's what it said.
So let's put this off to the side as a decision or discussion, because I think there's other things on the list that are related that we need to discuss.
Like what? Go ahead.
Like contractors.
Yep.
So I have a list of vendors, and Ed, you can jump in here if you wanna take over this
With my list.
discussion, but I have a list of vendors.
Yeah.
We gotta figure out either we're gonna require them to be vaccinated,
Mhm.
or we're gonna segregate them. And what I've said to Ed is, my recommendation is, I mean, we've got vendors here that essentially can stop outside the building, drop their stuff and leave. I would prefer that we segregate them
Mhm.
and put that in a letter from the administrator that once this policy is implemented, you're not coming in the building.
You think that's gonna be enforced?
I think that you're gonna have to enforce it.
You think the front
Otherwise-
desk is gonna enforce
Otherwise,
that?
we're gonna have to see proof of everyone who is a vendor on this list and more. And we're gonna have to either see proof of vaccination, or we're gonna have to see proof of an exemption, a
But-
valid exemption.
Don't some vendors have to come into the building to put their
Well,
stuff
that's what
in?
she's getting at, segregating the list. The list we have, say, Cisco comes, they just bring everything to the dock,
Okay.
and that's where it stops.
Yeah.
Laundry brings it to the dock, that's where it stops.
There's other
However,
vendors that are
the-
patient care
the-
vendors.
Yeah.
You know, the
Right,
ones
right,
who
right.
come in and they do the fire extinguisher, you know, the smoke alarm test, I mean, they're all over the building. They would need to sign an attestation saying that their staff that's coming in
Is
is
vaccinated,
vaccinated.
yes.
And the rule applies to all nursing homes, so there's only a handful of vendors that do these different fire alarm tests, so they would be subject to the same rule at all facilities.
So let's talk now about, so that, I think that's a process that we can manage,
Yes.
Yeah.
about how to deal with vendors, whether they're coming in the building or not coming in the building. What about county staff?
Can I just ask, do the vendors just drop off this big load of stuff and then Clearview staff is hauling it all in?
I don't know.
I mean, like,
Yeah, that's probably
It's some,
what happens.
so, on some things, they're like laundry is dropped off, they pick up our dirty laundry is taken out in bins for them to pick up, and then the clean linen is brought in
Yep.
by our staff, and they disperse it to
That's
also
perfect.
our staff too.
Yeah, so we can
Cisco
manage.
drops off theirs, and then the kitchen staff does unload
Yeah,
on
that's,
their stuff.
that's
What
fine.
happens in the case of, for instance, back in the day, maybe they don't do it that way anymore, but for instance, dairy. The dairy, the person that brings the cheese and milk
And
and
that's where
stuff.
we would have a we would speak with Heather, talk to her. Do they
Because-
come in, and do they rotate the stock? Are they in the building rotating the stock? If that's the case, then they would be subject to the,
No, what used to
CMS rule.
happen is the dairy vendors came in and made sure that everything was still, within the,
That's
what
what
do
he
they
was
call it?
saying, rotating
And
staff.
they rotated and they take bad stuff or over
Bad
the
persons.
use limit.
yeah. I don't know if they still do that. I'd have to talk to.
That's the way it used to be, but
Yeah.
like I say, I don't know.
But I mean, and that's what we would do. We would go down the list and we would decide,
But they would-
are they just dropping stuff at the door? UPS just generally drops it at the door. Is this person just dropping it at the door? Or is it, like you said, they come in and they rotate the stock? Is it,
If they would, obviously, they'd have to be.
does Medline bring in medical supplies, or are they just dropping them at the dock? You know, and that's, you know, and that's the point of our question of what we're getting at here. Do we want to have, you know, a vendor that's not even coming in the building, signing an attestation, because they're not even coming in.
Okay, I got it. We'll make a motion. I move that we allow the administrator with court counsel to develop a segregated list of vendors for those that are not entering the building will not be required to have vaccination pursuant to the rule. And then those that have to come into the building will have to comply with the rule. We just have to comply with the rule. So I move that.
Or can we just have consensus that,
I don't think we should have consensus on this.
well,
I think you need to make a motion. It's the policy. This is a policy.
Let's have some, it would be good to have a motion, so we
Yeah.
can document it in the minutes.
Right.
That that's the direction that you're giving to the administrator, to go through the list of vendors, segregate those that don't need to come in the building, and for all others, they need to, have either their contract amended, to require that they only provide employees to the building that are vaccinated or have a valid exemption, or that we don't use them anymore.
but do we need what I was getting at is, do we need a motion for every one of these articles? I mean,
No.
like, you were wanting to go to county employee, people. Do we have to have a motion on that one, and then have to, maybe a visitor, do we have to have a motion on that one?
I think-
No,
Can't
visitors,
we just put them together? or-
we actually handed these out to you so you can read it before the next meeting. CMS already came out with the revised visitation policy.
Yeah, I see.
That one we don't have any control over.
So what you could do in lieu of a motion for each one of these items is, if it's a consensus of the committee, you can direct that how we're gonna deal with the vendors be included in the policy, and then you're gonna ultimately want to adopt the policy
That's
by formal
where
motion.
I was going. Rather than having a motion for each.
Oh, okay. So what is your consensus on that? 'Cause she's gonna have to take minutes whether we have consensus
Well,
or
I
not.
didn't disagree with what we're saying
Yeah.
on contractors, that we can have a segregated list.
So do you agree with that, guys?
Well, with me, I don't know.
I'm asking you. That's what they suggested.
I agree with that.
I agree with that.
Okay, so you can make that by consensus, the committee's agreeing with the segregation policy,
To incorporate that into the policy.
to incorporate it into the policy, yeah.
So then, and I do think then you need to have a discussion about county employees who regularly enter the building, like IT staff, maintenance.
I don't think that's a discussion. I think it's really clear from the rule, in the words, they're in here, they're in contact with people who provide services. You cannot exclude them from being physically next to somebody who's providing services.
So how is that gonna work then? If the county itself isn't mandating it, how are,
So the CMS rule takes priority, right? And so we have to follow that rule, and that rule, well, I know they don't like it, but I'm positive what I read. Anybody who comes in contact with caregivers, okay, has to.
I'm not arguing that, I just wanted to know the logistics of how we're gonna do that. Say IT needs to go over
I think
there, how are we
they
gonna-
know, do you know the people that generally come into the building? No?
We're just having a little sidebar conversation. I'm thinking about, like, for instance, IT. If there's a way that we can not have IT come in the building, that'd be best.
Yeah.
They could do virtual consoles or whatever
Sure.
IT does for the business office or for your systems. But I think maintenance is gonna be a different issue, and if you're gonna extend the policy,
IT has to come, there's lots of.
There's
things.
copies.
yeah.
There's
Yeah,
quite a few
so
things.
if
Copy
they're gonna have
machines,
It's like
internet
It's
quite
no
a bit.
different from a
We also
vendor.
house,
Plus, we're
we house
responsible
the
for them.
county's servers.
In the basement,
Yeah,
yeah, disaster recovery room.
yeah. So I mean, we,
Just like a
But they could-
contractor, they're inside.
Yep, they
yeah,
are.
but I mean,
How is that?
the county servers are housed there, so I mean,
County
you don't have to.
level though, then, so is all of IT gonna have to be vaccinated, just?
Well, they could segregate that only certain people come, but then if there's a problem, we have a meeting,
Logistically, is
we
that
can't
gonna
get this going, and the guy that's vaccinated is on vacation, too bad, we don't get our IT fixed.
That's what I mean, like, how is that gonna?
So however you wanna,
All this has to be managed. It's just another layer.
well, that's what they're asking, so.
Well, I agree with you, and they're not disagreeing with you,
Yeah.
that
And I think some of this is just so, and some of this is just for your awareness of what the complexities are gonna be. I mean, yes, it's strictly Clearview, that's governed by CMS, but just because of the way the rule is written, it does affect other county
It does.
employees.
It absolutely does. And we can't, so understand that
We're not
I'm,
going out there for a meeting.
I'm normally,
Yeah.
Because it covers you too, if you were to.
I am
have
normally
meetings out
more risk-taking when it comes to the law. I admit, I would, but I am being more conservative because if I'm right and we get surveyed and that surveyor comes and sees an IT person and checks their card or vaccination and they're not, then we're really screwed. Now, nobody's gonna take our license away, but we'll
there.
definitely,
Not the first time. but
not the
you're
first
right.
time, but we'll definitely have a punishment of some kind. So,
So what I would like to propose and what Supervisor Keel said is, there are no county staff coming into that building are no different than a vendor.
correct.
And maybe Supervisor Dur said that too.
Mhm.
But what I would like to propose is that we really limit the county staff coming in that building so that we don't have to have everyone in the corporation council get vaccinated.
I think you're gonna have to talk with
Everyone in
Ed.
the IT department getting vaccinated. We need to be strategic about it and think about.
I mean,
who's coming
your
in.
initial comment was say, yeah, they can telehealth, and he's like, oh my God, no. So I think you have to have a more detailed
And that's
off-site.
what
No,
we
it
do out there.
depends on what,
Conversation.
yeah, you're right. It depends on the
And
position.
it depends, yes, and it depends further on whether or not you're going to decide that this is a countywide, campus-wide policy or just for the nursing home.
If it's just for the nursing home and they don't come into the nursing home, they're fine. But obviously IT comes into the nursing home.
It's more, I'm not worried about IT, okay? Got that covered. I'm confident of that. The issue is more so directed at maintenance, specifically at Northview Heights. That's a bigger issue.
So they're doing maintenance here and maintenance at Northview.
No, they do maintenance, mostly there at Northview. We have
Like
our
both.
maintenance staff covers Clearview. But it's-
Do you see how intermingled now we are between
No,
us?
just let me
and
finish,
the
Lisa,
facilities.
please. Just let me finish, please.
Sure.
It's, the focus is on Northview Heights,
Mhm.
not the main building, just Northview.
Okay.
Is that, will that be segregated from a maintenance standpoint as far as, or will anybody who performs maintenance at Northview, because that's an assisted living, which isn't part of the requirement, will those county maintenance staff have to be vaccinated to enter Northview Heights? That's the issue.
You can ask maintenance if they wanna say, you people are the only people that go to Northview and you cannot do anything in Clearview, and then they have to follow it.
But
But
if
the,
we make
just to
Northview
clarify,
part of it too.
the current maintenance staff does not go into Clearview. They're just focused on Northview.
Oh, they don't go to, they're separate?
No, they're
No,
separate.
but that's
County maintenance
the point.
takes care of Northview Heights.
Yes.
So,
Who does our maintenance here? Owens Maintenance staff?
Yeah.
yeah.
And the reason that was set up that way, I mean, going back 9 years or so, is because Northview is in the Henry Dodge
Right.
building.
Yes.
It's a separate facility.
But they're also, I mean, I was thinking of human services, but they're also a facility, isn't it, right? No, there's no patients in there anymore. I'm blanking.
Northview, that's where our
Northview,
senior.
there's-
Well,
Northview, yeah.
I'm thinking of Henry Dodge. I'm so sorry.
Yeah,
I had the
Northview is
wrong
located
building.
inside of Henry Dodge, and we have 20, or we have
18,
capacity for
20,
20,
yeah,
18, 20
20.
residents there. So, that kind of goes back to the question of segregating it. If you
Correct.
segregate the assisted living from the nursing home, because that building has a lot more outside, do we want to get to the point of saying everybody entering Henry Dodge has to be vaccinated? I think we're.
Don't go, that's not what we're talking about.
No, but I'm just saying.
Just be careful there,
No,
because that's not what we're
I'm
talking
saying,
about.
if we get to,
Yeah, but if you
if
say that
we put the mandate on
Yes.
No.
Northview Heights.
It's not what we're putting it on. It's what the rule
But
requires.
if it's campus-wide, doesn't that include the Henry Dodge building?
No, because it's a lock, the Henry Dodge employees cannot access Northview Heights. That's locked from the inside.
No, but do any nursing staff or anybody from Clearview go to that facility?
Go to Northview Heights.
Yes. I see
Yes,
her
they
nodding
do.
her head. Yeah,
The nurse.
But they're Clearview employees,
Right.
so they'd be going to the assisted living, so just to clarify.
Only to the assisted
the-
living.
So vaccinated the CMS rules for nursing home regulations. So my staff, my nursing staff at Clearview would be vaccinated. They do go to Northview Heights in the homes to assess, but they would not be under the rule. So my nurses working in Clearview are still vaccinated. And although they leave to go assess the residents, there's no rule that says that they can't assess a resident who's not vaccinated. I mean, we have residents in Clearview who are not vaccinated that they assess. But, so they still working in Clearview, still vaccinated. They would leave to go and assess Northview Heights, but they would, if you choose to segregate them, they wouldn't be in the rule. So,
the question is, what does the rule include, not what we want it to include? And so it's not whether your staff is vaccinated, because they clearly are here and they're nurses, they have to be vaccinated.
at Clearview.
So the question is, who are they in contact with on a regular basis, not like once a
But
week?
they're not over there every single day. They're over there to give a quick injection, or if somebody falls, they'll give a quick assessment. They're not over there for hours at a time.
Neither is the contractor, which the
anything like
rule
that.
makes clear has to be covered. So you see my point? It's not who's giving direct care, it's who's giving direct care as connected. I'm glad I'm here, because I know this is a huge thorn, but I'm sorry. If we get a survey, we could really get our butt chewed if they run into that person, right? And it could be IT, it could be a contractor, it could be somebody from it could be anywhere. We just really have to make sure that the tentacles that connect to primary care, it's primary care and the circle of people that primary care come in contact with.
That's fine, but then can we circle back to the maintenance issue at Northview Heights?
So Clearview Maintenance does not do the maintenance for
The building maintenance, that is correct.
the Northview Heights.
Correct.
That's a different group of people.
But is it, we talked about staff over at Northview, and if they're gonna come to Clearview, and we never really finished, did we?
No,
Maybe
you
I
said
missed
we're,
it.
you said we
What
look at the-
happens to the staff up there, right? Because whatever we do with the staff, I think we're gonna do all the way around.
I don't see where you went.
And that's a valid point, but then we need to know, we internally, how to handle that maintenance aspect at Northview Heights, because it's a separate and distinct entry point.
Are you saying that maintenance, and I'm happy if this is true, that they don't come in contact with nurses?
Well, they'll come in contact potentially with whomever is in Northview Heights, whether
So the
it's,
answer is yes.
whether it's Clearview staff or not.
What are the chances of having Clearview's maintenance do the maintenance only in the Northview Heights section? Then they don't really be covered, right?
Well, you can do that, but we're really screwing up with our,
I know.
we're really messing with our work staff and our workflow, which is what we're gonna do.
Well, regardless of what you do.
though.
Hmm?
I said we probably will either way.
Yeah, it don't make any difference. You're gonna screw it up regardless.
Frankly,
If you would leave them separate as a separate entity, that they wouldn't, that they're not, then the maintenance would be able to,
Correct.
if you include them
Correct.
in the campus, that's the question, whether, I mean, ultimately, it's if you're gonna include them or not. Because if you include them, maintenance would need to be separate.
Again,
If you
that's
leave
not the
them
question.
separate, then
the
they-
question is, are you going to segregate anybody who is in primary care at Clearview? Are you gonna segregate them? It's not whether we put them in the rule applies. So when you say not put them, are you segregating so nobody, and I'm fine if you wanna do that, you're gonna not have, those people are gonna have to take a pay cut, and they can't come into Clearview, and Clearview can't come into the assisted facilities, which is insane. Like, we are one campus.
If they decide they don't want to take the pay cut, and they want to retain their CNA status with Dodge County, with Clearview, they would be allowed to come back over to the facility, because
Sure.
they would be vaccinated at that point.
Yeah.
If they choose, and that's what I'm saying, we can, if they don't want to get vaccinated, we have the opportunity to treat this group of staff. If they don't want to be vaccinated, and they want to maintain their employment, we have the opportunity not to require them to be vaccinated. However, if they want to come and work in the main building at a higher, and be able to maintain their higher rate of pay, they would get vaccinated.
Correct.
And I think by segregating it, we're allowing ourselves to not have to require Dodge County maintenance to be vaccinated to go into the CVRF. So
Personally, I
it's a
think
bigger
this
question.
requires more thought, and I think it's a good flushing of the issues, don't you agree? I mean, we're flushing them out, and it's a good discussion. I'm not ready to, I haven't looked back at that specific rule. It's 1213. I don't know what you're gonna do. You can have some, preliminary policy.
What I would like to, and what I would like to do is get the committees, if it's, after Kim's reading of the rules, if it's allowable that we can carve out the assisted living in the group homes for that staff. If it's allowable under, if we can do that under the rules, is the committee okay, does the committee want to go that route and allow them to be carved out? Just going forward, because we have to start implementing our policy.
I get it.
We're meeting with the staff later.
When you're carving them out, Ed, then you're saying they can't come into Clearview. Like, we're gonna have then you can't come in. You wanna be unvaccinated, you can't come in, and you can't be in contact with people who are in. I mean, that's a tough line.
Well, I would suggest that what we.
Well, it's not that they can't come in contact with Clearview
Yeah.
staff going over there, the fact they can't come in contact with, in the building. They can't come into the main building.
What I would
What's the
suggest-
difference? What's the difference if you're in contact with a nurse at Clearview in a different building versus a nurse at Clearview in Clearview? It's the same issue. It is the same risk. A nurse at Clearview can get this virus
We have a
in
difference
either
of
place.
opinion here. Legal opinion.
Well, we have
That
the,
I would like to have reviewed
yeah,
and
I agree.
reassessed. I have not read the rule.
I
I'm not going to,
I wanna read the rule too.
My recommendation is at this point, I'm not a lawyer even if I read it, so I'm not going to go there, but I would like to say at this point, I would like to see you keep them separate, because I think that gives us as management a little more flexibility. I question whether, yes, it says that they're separate, for assisted living and group homes, that they don't cover it, but I would like to have addressed specifically researched, does it make a difference because we have one employer? And they're separate, but we have, just. when
We're
you
just
look
sort of in
at-
a unique situation with this one,
Right.
because we don't fall under OSHA.
Correct.
We don't fall under OSHA, and CMS specifically does not govern assisted living. CMS does not govern assisted living facilities.
They don't govern.
What Lisa is saying is a little different issue. It's a
Okay.
different issue, because she's talking about contacting.
I am.
Yeah.
And I do
But
wonder.
CMS does not govern assisted
Right,
living.
and they don't
Okay.
govern contractors, right? But they have the right to affect anybody coming into the building that has contact with the staff. That's the issue, it's a contact issue.
As an employer, legally, can we say this section of our staff has to be vaccinated, but this section does not have to be?
If
Is there
you
any
do that,
issue there?
If you do that, you cannot have this flow of people back and forth. I think that's gonna affect your care, but.
So then, Lisa, you're saying that the staff from Northview Heights and the staff from Clearview can go to lunch together because
I'm not
one
saying
might be
that.
vaccinated?
I'm saying from the way I read the rule, it appeared to say that if a contractor comes into here,
No, that's not, I'm talking about employees, Lisa.
they, yes,
Is that
Not
really
the
what
lunch.
you're saying and meaning?
I believe that's what the rule means. The rule wants people in contact with the primary care staff. If you come in contact with them, you need to be
work
vaccinated.
Well, in the scenario of lunch, if it's lunch outside of work, we have no control over that now.
Well,
But
that's
lunch
not what I'm
during
hearing.
break is-
That's not what I'm hearing from
It's-
Supervisor Durr.
I don't know, when you said lunch, I thought you meant in the building lunch, but that's also a problem, right? I mean, you can,
Oh,
I
no,
thought you were
because-
talking about in the building lunch, and I would say in the building lunch, no, because you're saying you're not gonna have contact. Look at the specifics of the rule. I mean, how can you say it applies to contractors, but we don't like it, you wanna make a legal distinction, but you know what, the germs go whichever way.
Well, no, the contractor's coming into the building. If
Correct.
the staff from Northview isn't coming into the Clearview building, then they don't fall under the contract.
It's not in the building. If the staff comes in contact with a primary caregiver, that's not the issue. It's the primary caregiver. I don't care if the caregiver is in this building or in another building, right? It doesn't matter. If you come in contact with a primary caregiver for the people that are here, meaning here, at Clearview Nursing Home.
But then with the whole like segregating the contractors, even the ones that don't come into the building, would they come into contact with somebody, like to sign something or something?
Well, that's what they're saying. They're saying, no, they're gonna be outside, they're gonna be 8 feet away, here's the bus, or here's the van, and then the ladies come in and take the stuff off,
But
so
they're
no.
still gonna be in some form of contact somehow, wouldn't they?
Not within 6 feet. That's what they're saying. They're gonna be, you know, we're gonna unload the stuff and you go in.
I tend to disagree with that, because I can't imagine somebody not having to sign for a delivery of a major dollar amount of stuff.
But that contact is gonna be so de minimis if there is any.
And it would be
I understand
outside.
that, but
It would
contact
also be
is contact.
outside, which might help, like, so, you know,
Yeah, but being outside versus being right here is not gonna do anything.
So I guess I'm trying to find a way to kind of bring this around to how we can make some progress, knowing the hours late and we need to move forward with the policy. Remember, one, that this is a CMS rule and it applies in certain circumstances, but not in others. Number two, the idea of the rule is mandating vaccination for primary care staff, essentially. And three, we should not read it in a way that, and apply it in a way that it makes it so absurd. Because we all have lives and we all don't just spend 8 or 10 hours in, like for my circumstance, in this building. So we need to recognize that people are going to be circulating throughout 24/7. And so the idea is to get as many people vaccinated. Again, this is not my rule, this is not my law, whether I agree with it or disagree with it, not my concern. But we need to implement a policy that gets people vaccinated, employees vaccinated, who are in primary care, patient care type of scenarios. And others who might come in contact on a regular basis, like the therapy vendor.
yeah, actually,
Get
it
the
said,
ones-
Others, let's try to
That's
carve
not what
out
they
and
said.
figure
Get the
out.
ones that has to be by the rules.
Yep.
the rule said
Make
they
it
can be
just
infrequent.
Lisa.
They can be very infrequent,
Lisa.
but those
Lisa.
contractors have.
Lisa,
Let me talk once here.
Go ahead. That's
The,
not what the rules say.
I think what we should do is just let Kim look at what needs to be done by, and she can look at some of your concerns, but rather than just keep talking about it, bring up something that would include that, and then I would go with whatever Ed and Clearview, the managers, and the others are there to figure out what should they do with Northfield. Do they include maintenance or not? And they can go through that with Kim, and they can explore that. Do they not allow those people to go to the grocery store or not, or do they?
No, that's
come
not
in
it.
or not?
Nope, that is,
Whatever.
we have no
But
regulation
let
of their
them-
private life. That's
Let them
crazy.
decide something, bring it back, and then we can look at it, because we're gonna talk all.
We're not talking about people's private life, okay? We are not controlling anybody's private life.
Okay, but either way,
Oh my
let
God.
them come back with something that
Well,
makes
for
sense.
today's discussion, because we need to have the policy approved, because we are,
Yeah.
the clock is ticking on it.
Pick
So
out what you
we're-
need
we're
to have.
meeting with- We're starting our meetings with staff this afternoon to let them know that.
I'm just asking,
These are
Can we
these are
do
the
the
time
name?
horizons.
I'm just asking that you consider.
Lisa,
Go ahead, I'm sorry. Go ahead.
can we do the main facility and deal with
Just get
this
that done.
part of it?
Yes.
Do you research it and
Yes, we
come
can
with a
do that.
recommendation?
And I will come back with a report to the committee. Yes, we can do it in the, again, in the interest of getting the policy implemented, you all know, it can be amended. So
Yes.
let's get the bulk of the policy implemented so that it can be rolled out for those that we're absolutely certain of. You know, we know that we gotta do something with regard to the employees in the nursing home. Again, like it or not, it's a fact. And then we can come back and
That
take a
would
look
make
at some
sense
of
to
these.
me, because we're just going round and
Points
round
that
and we're
were
not
raised.
getting
In terms of
anywhere.
Northview, we
I
don't,
mean-
because it's not required specifically under CMS, but it's on us after December 6th, to ensure that no unvaccinated staff from Northview, Trailview, or a community group home is coming in to Clearview.
In contact.
That's on Aaron and Dina to make sure that doesn't happen,
I
until we
think-
make a decision on whether or not we're gonna enforce the vaccine mandate with them so they can come in between the buildings.
I think part of the supervisor's problem with this is that if we're gonna implement it, it's gotta be according to the rule.
Thank you.
And if we're not implementing it according to the rule, how it's written, what are we even doing?
Oh my God, yes. Like, we're letting the tail wag the dog, it's inconvenient, it's whatever, we're gonna artificially say these people aren't. The question is, if it's true that this applies mainly to primary people, like you said, then it wouldn't cover contractors. But it does cover
Okay,
contractors.
so I don't want to belabor this point, but I need to say this, okay?
Go ahead, you
So
can do
I've
whatever you want.
researched it, here's what I've come up with in terms of an interpretation of the rule. Okay. Who is staff? And it gives the basic staff definition. Facility employees, administrative staff, facility leadership, volunteers. What are the limited staff exceptions? Okay, here's limited staff exceptions, who it doesn't apply to. 100% telecommute, okay, you probably know that, we don't have much of that. One-off non-healthcare workers, volunteers, vendors, or professionals, such as annual elevator inspection, such as inspecting the fire extinguishers,
Are they annual?
if it's annual.
Yeah.
So that's
That'd be
the
great.
definition. Okay.
That's how help.
Individuals performing services that are exclusively off-site, legal, accounting, professional services, right? Individuals who infrequently, not routinely, but infrequently enter a facility. So you can even infrequently enter a facility for delivery, milk delivery, dairy, whatever it may be.
Well, that's pretty regular.
For specific purposes for a limited amount of time, including personnel that are delivering, including repair services. Doesn't say maintenance, because maintenance is above in the staff.
Maintenance is not infrequent.
So I think we have an opportunity to comply with the law, comply with the rule, and carve out some of these exceptions. And I would be willing to rely on this interpretation, and I'll give you my legal opinion to implement it into the policy to carve out some of the exceptions. I think it's reasonable to do so,
What do you mean by infrequent?
and we'll define that. Infrequent as opposed to routine.
Right. But can I ask this then? Are we then gonna say that we're not gonna regularly have staff go back and forth then to help out, right? Like, so if somebody's in the assisted living and Clearview needs help, we can't have them go back and forth. I'm just clarifying that, right? Because that's not infrequent, like,
It wouldn't be infrequent, and again, that's
so they can't
In
go back and
operation.
forth.
Well, even if they're after, that, you know, if they were to come over and work a shift, that's very different than a UPS driver coming to the door and getting a signature. That's,
So again,
Yeah.
so you're saying,
the amount of
correct, they
exposure
can't,
is very different.
so you're saying no, that you would segregate those workers, they could not come back and forth.
you'd either segregate them or you mandate the vaccine on them, one or the other.
Yes.
Dan would like to speak.
Yeah, it seems, as I'm listening here, this rule is turning Dodge County on its head. I see a lot of gymnastics here, we can probably get a gold medal. Implementation, it almost seems is going to have a good chance of putting Dodge County at high risk of going out of business. When I see all the different buildings, I don't understand it all, but I see all these interrelational things, and we're trying to
No.
change that or affect that or control it, and it's about as easy as controlling the virus. Maybe Dodge County would consider filing an injunctive relief action at our federal level to help us out here.
But against whom, Dan? On what legal basis should we do that?
What did the others do for legal basis? I mean, let's think a little
No one
bit.
has appealed this,
I'm not
because it's
gonna be-
OSHA that was
I'm not
appealed.
going to be debating you, Lisa, because I can't.
Yeah, well,
talk
you
that
file your
much.
injunction, because I have no idea what law we'd actually
We
rely
have a
on.
fine group of lawyers that are on staff that could be considered, able to consider this thing and give us direction. It's like, let's go out of business, or let's take our staff and tie them in knots and pretzels and keep them here and keep them there, and what about this person, what? It's
Do we have any
amazing.
valid legal claim that we could file an injunction on?
You don't think going out of business because of hardship, undue hardship is a legal claim? Of
Yes.
course it is.
I do think there probably some legal basis to file something, but quite honestly, is the county board gonna authorize my office to file a federal claim against the CMS rule? Maybe it will, but bring it forward to the county board. I'm not gonna do that without any authorization from the board. Right now, my focus is to get a policy in place that complies with the CMS rule so that Clearview can continue operating.
At the same time, I mean, we need to implement the rule. And if the county board wants to see conjunctive relief, we can do it
At the same time.
at the same time.
That would be, would that not be, re-licensed in federal court too? Have you done a federal, well,
I'm not volunteering.
there's a reason nobody's filed this, okay? Because we don't have any basis for that. We just don't.
So,
All right, so moving forward. And then just one other thing, you know, just because of the nature of the, you know, getting the vaccine, other providers have provided some sort of financial incentive for employees getting the vaccine. Is there any interest in doing that for those who have received the vaccine, and just as a nudge for the ones that haven't gotten it yet, as a thank you?
I know keeping your job is probably a pretty good.
I understand that. I'm just throwing everything out there.
I just threw that out in May, June, July, August, and you know, you weren't interested in that idea. And so now it's mandatory, and what are we gonna do? Give everybody that bonus, that all the people that just like voluntarily did it, and now we're gonna give them money, and then the people who didn't give them money, and how are the people that like just went and got it gonna feel?
I personally would not go that route, because if they didn't take anybody up on it already, some of them were given huge.
We're giving them a COVID bonus.
Yeah, we are.
There you go.
A significant one. How much is the COVID bonus they're
And
getting?
we didn't segregate out people that didn't get a vaccine, because that was brought up.
We should have held that out. We should have.
Why,
done that.
we did bring that up.
Yeah, we did bring that up.
They didn't have a rule then.
We didn't get a rule,
They didn't have to
regardless.
say that's rule.
I understand that, you know, we have cover now, we're required. I understand that.
Okay, so, in terms of moving, okay.
Jim,
Is there a willingness, or you think it's appropriate to meet again before this gets implemented?
But we have to begin implementation now.
But
What's your deadline for the policy? I thought it was December 5th.
Yeah, but people need time to file exemptions.
So how long would it take
to get denials?
Kim to put something together to get the main facility and what we talked about?
Yeah, whatever you do. I just-
Additions to the existing policy, defining further to what it applies.
I would just be careful how you draft your policy, as opposed to like, you know, hey, we're excluding this group versus based on contact, because it's contact that the rule is really about. It's about contact, so if you can segregate it based on contract, it's gonna be more protected. I'm not gonna go back and,
It's
I
up to
would
the,
think if we need to discuss this any further at another meeting, we need to do it within a week, because that's when you're leaving you.
I'm fine with whatever you put out.
I'm okay with,
Can we move forward with this for the nursing, because it's specifically, the rules are very specific and clear for the nursing home.
Right.
And then we can discuss the assisted living at the next meeting.
Okay,
Okay, are we in consensus that this policy with the one little word change is fine?
Go for it.
The main one.
I don't like not having a set answer to that.
Yep,
honestly.
I don't either, but, I mean, let's.
I do not need my name on something that's not, that's a maybe this, maybe that, personally.
does the committee want to meet next week then with a policy that, committee's got to do the work,
You guys can,
you know,
No, it's not,
Our
it's
issue
just,
is our staff, the timeline's ticking for the staff, and they have to.
I understand that, but-
And Thanksgiving's in there, and they have to get their exemptions.
But there needs to be some clarity, so everybody, I mean, if the committee's not clear.
I think it's gonna be confusing if you talk to people and then they're like, what about this, what about that, and they're like, oh, we haven't worked it out yet. Like, we're not going to lose, everybody's not gonna quit because we don't
what's the consensus? Do you want another meeting?
Well, they're saying that they, for timeline purposes, they're saying you have to talk
Yes
to
or
them.
no?
I'm gonna ask you, are you saying for timeline that you have to talk to the employees tomorrow?
Well, we need to talk to the staff about, because there's timelines on the religious exemption, medical exemption. And if they want to pursue something like that, I mean, today is the 16th and the deadline is December 6th. So they have to go and get that, get it approved or get it denied and then start moving it up to the next level of
I thought just,
appeal.
what I heard, I thought just the policies had to be in effect on the 5th, which means then they can go get theirs. No?
No,
We'd have
you
to
have
have
to
the
have
first-
that.
All right,
The first vaccine by
by
December
December
6th.
6th, all right, then you're right.
You need a vaccine or an exemption by then.
Yeah, okay, that's really fast. I wish they'd have done this sooner, given us time.
So do I.
Were you on that call, that hour-long call? Because that's the call where he was saying, and he asked the older gentleman with the beard at the end, he said again, what if somebody comes in and blah, blah, blah? He made that contact point very clear. So it's not that we're excluding buildings. I think we're gonna get in trouble if we make policy based on buildings when the rule is about contact. That's all I'm saying, keep in mind, however you do this.
Yes or no on the building? On the meeting? Yes or no?
I'm fine if you can kind of phrase it that way, if that's our policy, do you know what I'm saying?
Let
Based
me
on
ask-
contact.
Aaron and Dina, because whatever, I can say one thing, but they're.
They're making
You know
sad
what?
faces.
I'm making, she's making faces at
She
me,
is.
and I wanna make sure that this is gonna work. What works best for you, Aaron?
I just wanna be sure that the staff have enough time, because it's gonna be, they're all wondering, I think they all know that a mandate's out there and it's
Yeah.
coming, but they wanna know what can they do to either not get the shot,
Yes.
or if they need to move forward and get the shot.
Mhm.
I mean, and get everything turned in time, I think is gonna be their main concern, is what's gonna happen to me if I don't get the shot? When do I have, and to get the exemptions in by, like, those are the primary things that they wanna know, and what we've decided to do. But otherwise, I think they all know this mandate's out there, we've kind of gave them a little information saying it's been out there, if you wanna look it up, you can look it up. I think the policy that we wrote, in my mind, is specifically for nursing home, because that's what the CMS says. So couldn't we just move forward with the policy for the nursing home and make an amendment if we decide to do group in Northview Heights and community and the group homes? I mean, really those staff, because of low staffing, it's generally not that we pull from there. They have their own staffing issues, and Jessica, their assisted living supervisor, does a lot with them and covers a lot of shifts. We generally don't have staff to already pull over there, or to pull back and forth anymore.
All right,
We don't.
okay.
So the staffing that they have is generally the staffing that they have. We have a couple, but they're gonna be vaccinated. So
Yes.
anybody in our building is what the CMS guidelines say, is going to be vaccinated.
Yes,
Where they go, when they go home,
that's
or
not
where
what
they
this
go,
about.
whenever.
Yeah.
But
So
when
do
they're
you-
in our building, they're vaccinated, and that's what the CMS guidance
Do you
right now
feel
says.
comfortable, Haley, if we say for sure that we agree with the part of the policy that, because it's not even rewritten or looked at, I know you can quote research it, but that was just a couple minutes, right? And I'm okay with moving this through with just applying, talking about just specifically to the Clearview staff, and here's how
And
how
just
it applies.
Thinking out loud with Jim's concern about maintenance staff at Northview Heights. Because Northview Heights is not governed by CMS, it doesn't matter who we have going in there for the maintenance. It doesn't matter who we have going in there. It's who comes into the nursing home.
Correct, yes.
So if we don't really need to be concerned with that. Anybody can go into that building. It's who comes into the nursing home. If we're not pulling their staff, we can hold off on making it a mandate.
Thank you. That's the perspective I'm trying to get us to look at. It's contact, it's not the building. Thank you.
Wasn't the argument before that Clearview staff going to Northview couldn't come
Previous staff can go over there, 'cause they're vaccinated.
Well, okay,
Yeah, but,
you're right, that's
you know,
not what I was
that's
saying.
what is that what we were saying earlier?
I was
Okay.
saying
wanted
that
to
if
follow
you're in
that.
contact with unvaccinated
Yep.
people and you're Clearview staff, it really can't be. So,
I'm okay with that and the policies and the exemption forms as they are, and maybe come up with a few more definitions
Yeah, we don't
of
have
those
this.
exemptions that you were talking about as far as infrequent, some examples of the kind of staff you're talking
We will
about.
do it with our
or that
COVID
is-
update at the December 1st meeting, unless you wanted to meet before then.
No, we got another meeting in 2 weeks
Yes.
about.
well, that should give you time though, but,
That will give me time, and I think just from hearing the discussion, I would recommend that you implement the policy as proposed with some minor edits, because as I'm sitting here today, I've reviewed it, and there's some things that need to be changed, not substantive at all, but more typographical.
Definitions.
Definition, I'll add definitions, and you can amend the policy on December 1st if you choose to. But what I'm hearing again as a discussion today is you can always expand a policy. It's easier to expand than to pull back. So I would suggest that you go forward with this policy
Isn't it-
as applied to the nursing home, because we're very clear on that.
Yes.
And then I will come back to you on December 1st.
but in terms of expanding, I'm just throwing out that you consider how you're going to describe anything beyond the nursing home, right? Because to the extent you describe something that's not affirmed or agreed upon, I'm just saying to consider that
When we describe
That's
it,
gonna
we'll
be-
say, this is the policy as it applies to the nursing home
first,
first.
and
And
then working on
Just-
other parts.
If we
Because-
so.
It's,
because it just, yeah. So, all right, so we'll go with that.
We need a motion to that. I
Yes,
guess.
yes, please.
Somebody make a motion.
go ahead.
I will make the motion.
Move forward with the COVID-19 policy. as
Policy
presented.
and forms, and there was one word at this point that only is being added
Yes.
on
What?
that one form. You added that word.
Oh, yeah, yeah. But also with future potential amendments by Corp Council or the committee on December 1st. And is that a motion or just a consensus?
Motions.
All right.
We're making a motion.
I'll second.
Policy
That was you
And
agreed
the
to that,
forms.
right?
Policy and the
Forms
forms.
it is, those are exactly like, what was that, the thing that I discussed, that I sat in on, those are almost, they're very similar.
Any discussion on the motion? On the motion, all in favor?
Aye.
Opposed?
I don't think I will on it, but,
I'm sorry.
yeah, I'm not putting my name on that.
So just say no. So one against, that's fine. Understand.
Motion carried.
I hope we get more, if I have time, that's the problem, I don't, but, I would like to at least look at whatever I was reading, you know what I mean, so I can verify what that was.
Did you want to talk about this, or you're not?
Oh, this is just Friday afternoon, CMS expanded the visitation policy for visitors.
Okay,
Apparently they told advocates over the weekend about it, or it was in a newspaper. They sent us this guidance yesterday at 12:30. We've updated our visitation policies. And it's just, it's just, basically, we can have visitation at all times.
are you saying it's updating expanding the visitation, not expanding the vaccination? It's
No,
about
no,
visitation.
it's all about visitation.
Okay, all right.
And we printed it for you in color because the red parts show what they've just added.
And then can I ask then, in terms of we were in COVID status, are we technically out of COVID status now? So we're still in COVID status?
The
visitation is up to the
visitation
difference.
rule doesn't care anymore.
Really?
Really, which is real interesting, given what they just dropped on us the week before.
Yeah, it is. It's so inconsistent. I don't understand.
And what's interesting is that they didn't warn us they were doing this, they just dropped it. Didn't send the memo to the providers, they sent it to they let the providers know at 12:30 on Monday, and this was effective Friday.
And where did they drop it then? Just publicly?
They haven't told us, we were told by.
Sometime over the weekend, they let
There's a newspaper.
Hickner know, because our association didn't know Friday afternoon, so. Yeah. At any rate, that's, I enjoy working with seniors, that's what I enjoy working with.
You know, when I was
I enjoy all the populations I work with, that's why I do it.
being in Hawaii the last 3 weeks, you
Really?
don't go into a restaurant without showing your vaccination card. They won't let you sit.
Can you register
What?
you need the cards that you get in Hawaii to do it?
That was a
Yeah,
state-
you have to have a special, whatever that.
That was a state law though, right?
That's a state law, but then from there on, after you're there, to go into a restaurant, even a Burger King or a Haagen-Dazs, you had to show your card or a completed test that you were within a certain period of time.
I wonder what their percentage of COVID deaths are in Oregon.
Less than 1%.
Yeah, well, what
Yeah,
about
I
that?
heard New York is like that too.
Less than 1%,
You have to show
huh?
your card to go in.
Less than
To eat
1%
inside a
testing
restaurant.
positive.
That's now,
And they wear masks
they
everywhere.
were in severe straits.
Right, it's huge. No, I know they were.
If you're indoors, you've got a mask.
They were getting it spread, Kim, from all the travelers.
Did we adjourn?
From the travelers were bringing it.
Even go into a grocery store, you go Piggly Wiggly.
Hey Larry, do you need a motion to adjourn?
I thought we adjourned.
Everybody's got a mask, otherwise they're told to put one on.
That too.
A second.